Hey everybody, Courtney H. Milford, the speech lady, back with you guys today. Today we are going to talk about what is speech. So we're breaking down the words speech language pathologist and giving you a quick overview into what those words mean and what a speech language pathologist does. So very often if your child is receiving therapy for either speech or language, you will just hear it narrowed right down to speech. It's just common, and even in my name, the speech lady, it's just what people say. You have speech therapy today. The speech teacher is coming. If you're in a school district, the child might be leaving to go to speech. Okay, so we are going to talk. We hear that word more than language, and so we're going to start with it. We're going to find out does speech mean, what does speech entail, and how is it addressed in therapy. So again, this is a short overview. It's not going to be an in-depth explanation, but a short overview meant for parents, teachers, early childhood daycare providers, or educators to know that there is a difference between speech and language. They are not the same thing. And to be able to maybe recognize the difference between the two, so that if they're having questions, if they're wondering if a child is on track, or if they're feeling like they need a referral or an evaluation, they know which area that they are actually listening for or looking at when they are trying to determine what's going on with a child. So we're going to jump right into it and talk about what is speech. Okay, so speech is the verbal means of communication. Okay, the verbal means of communication. So what you're hearing right now coming out of my mouth is my speech. Speech for many of us comes naturally, okay? As an infant, you're listening to the sounds that you hear produced around you. You start to imitate them. Then you start to put them together. Then you realize that you're getting a reaction from other people. Like when you say mama as a baby and your mom goes, yes, mama, I'm mama. And you then get to put meaning with your word, okay? And that moves into language, and we're going to go there another day. But today we're talking about the speech, the sound production. Each language has its own sounds, okay? We call those phonemes. Each letter has a sound. That's what we teach our kids. So the letter S says S. That's the speech sound, okay? And you use your articulators, which are things like your jaw, your cheeks, your lips, your teeth, and your tongue. Those are your articulators that need to all work together to produce proper speech sounds. So again, for many people, you just learn how to do that naturally. But for many young children too, there's a reason why it's difficult. We're not always sure what the reason is. Sometimes it's medical in nature. There's a reason, a medical reason, or a diagnosis for why they're having trouble producing the correct English sounds that go in words. And sometimes it's just that they never outgrew their younger pattern of speech. So for all children, it is likely that you will hear an immature pattern of speech as they mature, okay? So when babies first start to talk, their speech is expected to be difficult to understand. You may hear them saying things like yayo instead of yellow, and that's because they haven't learned the phoneme yet. But again, as they age, you should hear that pattern mature into yellow. And if you don't, at a certain age, would be the red flag where you're wondering, why isn't their speech maturing as they're getting older? So some other examples would be, when you hear a child saying, my thumb hurts, or I have to take a bath, okay? Instead of my thumb hurts and I have to take a bath. Depending on their age, it may be acceptable. If they're 2-3 years old, that's a common error, and we consider that typical in nature, and they're very likely to outgrow it, okay? But if that's a child who's in first grade, second grade, third grade, and you're still hearing that is something that should have been outgrown, and there may be a reason, or they may just need a little bit of therapy to learn how to use the sound in words, okay? That's what we call articulation. That's articulation therapy, and is one of the areas that falls under speech. The second area that falls under speech is what we call voice. Okay, it's when we produce speech by our vocal folds moving very quickly and then learning how to coordinate our breath with your vocal folds to produce speech. So if you have a raspy voice, a very hoarse voice, a nasally voice that sounds like you have a cold all the time, there could be something because of the structures in your mouth or up in your nose passages or with your vocal folds. So again, that's something we are trained to listen for and to either refer, if necessary, to other doctors, medical professionals, or to address in therapy if it's something that falls within our scope. There could be several reasons for it. Sometimes children with a lot of reflux start to end up with a lot of different vocal qualities, as well as children who scream or have a very loud volume of voice. They can end up with little nodules, things in their vocal folds from either overuse or misuse can lead to like losing your voice or having a really hoarse voice. Okay, so that's another area that falls under speech. The third area that falls under speech is what we call fluency. So fluency is the natural rhythm and flow and the rate of speech. Okay, so when you hear someone talk about they have a stutter, that's a fluency disorder. The rate and the rhythm of their speech is disrupted by stuttering or stammering over their words. It could be the rate. Your child could talk extremely fast, making it very difficult for them to be understood. All of those things fall under areas in which the speech language pathologist could target during speech therapy. Okay, so again, it is those three areas, articulation, voice, and fluency, are what we are trained in and what we are referring to when we are talking about a child with a speech and language delay or disorder. And part of our training as speech language pathologists is knowing what sounds should be developed by what age, which errors are considered typical versus which errors are considered atypical. No matter what age you are, you're not supposed to make that sound. Versus, okay, that's a normal error at this age. We have those skills and abilities. So if you are wondering if your child's speech is on track, feel free to reach out and ask your questions regarding speech. And I look forward to connecting with you and teaching you even more about speech, language, and communication and what it is that we do as speech language pathologists and how we can help you or your child communicate effectively. Okay, so today we talked about speech, we talked about articulation, voice, and fluency. Those are the three areas that fall under the speech umbrella, and I hope you learned something new. Again, feel free to leave any questions. You can email questions to me, you can leave them in the comments, or reach out to me privately via a message of some sort. All of my contact information can be found on my website, and I look forward to connecting with you. Take care.